Hey, it's Dr. Centeno, and I'm going to go into a common complaint that we'll see after, in particular, a PICL procedure, and that's a runny nose. Now, the reason why this happens is fairly simple. It happens in some patients who require a very high flow oxygen during the procedure because they've got a poor airway. They might have obstructive sleep apnea or mechanical sleep apnea. And as a result, we have to crank up the oxygen in order to protect the patient during the PICL procedure. Remember, we're constantly monitoring the patient's oxygen level, so we know when it can start to get a little low and we can crank up the oxygen. But when you crank up the oxygen during that procedure, that's going to really dry out the nasal passages and cause a little local cell injury there, which then can present as a runny nose for several days after the PICL procedure. So realize that in a subset of patients, maybe 1 in 10, 1 in 5, where we've had to use high flow oxygen to make sure that we maximally protect the patient because they've got an airway issue, that can cause a runny nose that should promptly go away in, let's say, 3 to 5 days after the procedure.
Hey, get this out to more patients by like, comment, share, subscribe. Thanks so much.